Hello, everyone. How was everyone's week? I hope you are all ready for today's eLotus webinar. My name is Myra Chen, and I am Dr. John Chen and Tina Chen's niece, and I am also now studying Chinese medicine. I am here today as your host and moderator for today's webinar. Here at eLotus, we have been hosting educational courses for over 3 decades, and we are so proud to be your trusted source for premium CEU content with over 200 speakers, 700 courses, and 3,000 hours of CE. We really appreciate you all being here with us today. Today's webinar is Decoding Acupuncture's Impact on Neurological Pain and Discomfort with David Soul, sponsored by Evergreen Herbs. Dr. David Soul is a physician trained in both Chinese and Western medicine, specializing in pain-related disorders, pulmonary issues, and women's health. Having had the opportunity to work in the pain clinic and in the ER, Dr. Soul understands the importance of integrating these two worlds of medicine into clinical practice to provide optimal care for his many patients. Today, he will dive into the intricate relationship between acupuncture and neurological pain, as well as its impact on hormonal and physiological responses. Let's explore and unravel the full effectiveness of acupuncture, decoding its pivotal role in addressing pain and discomfort together. Dr. Soul began speaking for us last year and has many great courses. I'll definitely link his other courses in the chat room below for you. My first eLotus webinar was Dr. Soul's class, and I was completely blown away. He talked about the idea of treating your body like it's a temple or a house. If you want your house to be amazing, don't you want to use the best materials? Well, same goes for your body. We need to feed it good food and herbs to nourish it and help it thrive. Who wouldn't want to make their body the best it can be, right? For our new attendees joining us, let me familiarize you with our webinar room. Please set your chat from host and panelists to everyone. That way, everyone can be part of the conversation. To ask questions during the webinar, use the Q&A box so the questions remain separate from the chat room. And lastly, the quiz. The quiz for CEUs will be available the next business day late afternoon for everyone with qualifying attendance. Now, let's get started with today's webinar and welcome Dr. David Soul.
Good morning, everybody. Can you all hear me? And can you see me?
Yes, we can.
Okay, fantastic. First of all, I want to thank every single staff at eLotus and also the Evergreen. Thank you, Myra, for your introduction. I am very humble to be here, and I was able to given a lot of opportunities to learn myself. And now it's time to share what I have learned with all of you. Is it absolute? Nothing is absolute. Nothing is absolute. But we're all experimenting. Now remember, Chinese medicine is based on observation. Now we'll go into detail on what that means. But to understand observation in Tao Te Ching, what helps us understand is to understand one, you have to know the opposite. So you have to always ask yourself what the opposite is. So what would be the opposite of pain in Chinese medical perspective? Or in any perspective for that matter. And so without knowing what health is, how can you restore health? It's very difficult. So make sure you're able to understand the opposite. So the polarity of both ends allows us to stay in the middle. And that's what the yin and yang balance is. So we can stay in the middle. As you can see the picture behind me. I don't know if you can see what's in there. If you can see what's in that picture, type it in. We went to the Salty Canyon, and it's in Arizona, and it's amazing. It's amazing, truly amazing. The color, the beauty, and most of all, Guess what we saw on the wall? And it's a heart. So the heart is all around us. It's all around us. And if you look for it, they're there. They're there. If you want to treat a patient, you want to make sure you treat from the heart. Don't treat from your head. There's a limitation to the knowledge because we don't know everything. We don't know everything. Since I started in medicine back in the 80s when I was in medical school, yes, I'm giving you my age now. Since the 80s, there's so much advancement in science. But are they absolute? Of course not. There's certain things that we thought it was one thing, but now it's no longer the same. And so why is it different? And what doesn't change? So it's understand what changes and what doesn't change. And that's the difference between constitutional and circumstantial. And same thing with pulse. And try this with your patient. Take their pulse and then ask them a traumatic question. See what happened to the pulse. Does it change? You can bet. You can count on it. It's going to change. It's going to change. So even when you're taking pulse, you have to understand the difference between constitutional pulse versus circumstantial pulse. And so when is the best time to take circumstantial pulse? Sleeping, actually. When someone is not conscious, it's a good time to take their pulse. Unfortunately, when you see patient, that's not really the case. And depending on where they are emotionally at that point, the pulse can reflect that. But a really good practitioner can differentiate the difference between the circumstantial pulse and constitutional pulse. And we can get into that another time. That's not the topic today. I'm still in the intro right now. I want to emphasize the heart, because without the heart, the treatment is not effective. And I'll explain why. I'll explain why that is. It has to do with energy. And so let's get into it. And so love, let me see, why did I skip it? That's okay. My passion in life is life. And what is life is love in full emotion. And love is therefore the key ingredient to health. You have to know how to love. And remember, you cannot give what you don't have. If you don't have it in your heart, you cannot give it. So you want to make sure you have it in your heart. Every patient that walks in the door, treat that person like your own father, your own mother, your own brother, or your own sister, and your own kids, and nothing less. And that's why I tell our staff, love them, love them. Love heals. There cannot be healing without love. And so we'll get into it more. So one thing I like you to do is for the future topics, if you can help me out, of those 6 topics, if you can pick three topics that you want to learn more about, and I'll kind of go over it, an overview of it. So the topic that we're going to talk about in the future, and I'll take 3. We'll kind of tabulate, see which one you're more interested in. And the first one is flow. The flow from the heart to healing. What does that mean? The only true energy in the universe is love. Why do I say that? Because if you look around, everything around you is created because someone loved something. It is love that allows you to transcend the energy. Love is the energy, but what kind of energy? We'll get into it later. And so flow from heart to healing. how do you stay in the flow? How do you stay in the flow? And so that's very important. How do you stay in the flow? If you're not in the flow, remember, you're the conduit for the patient because patient is blocked somewhere. That's why there's pain. In Chinese medicine, of course, the classic we talk about 不通则痛. And what does that mean? When there is no flow, therefore pain. And so if the pain is there, you have to understand flow is compromised. That's the two opposition. When there's pain, there's obstruction of flow. Always, always, always keep that in mind. For me, that's the starting point of my diagnosis, is where is it blocked and what's blocking it. And we'll talk about the pathogenesis of why is it blocking it. So the flow from heart to healing is how can you be the best conduit for the patient? And so that's one of the topic. And just put down number 1, 2, 3, or 1, 4, 5, whatever it is. And the embryological development of anatomy and meridians. And we can walk you through specific how anatomy are developed along with the pathways of the meridians and understand the meridian and the correlation to the anatomy of the body based on the embryological development. And why is it pre-heaven and why is it post-heaven? And we'll get into detail of that if you're interested in that. For me, that's very important because that helped me understand where the energy is. And are they always in the same spot? It's like going to the river. Are you going to find the deepest point at the same point all the time? Can it change? Water never flows the same twice. Same thing with energy. It can change. It can change. So you want to understand how the energy flows. And more important, the embryological development and how the anatomical structure are correlated to the meridians. And number 3 is formulate an accurate diagnosis. That's the most important part. And sometimes people say that's the most challenging part. And I agree. When you have an accurate diagnosis, then you can formulate the best treatment. I'll give you an example, which kind of interesting. I saw the patient probably a week after I did the last webinar. And the last webinar, it was on specifically one of the component is breathing, respiratory. And so the patient came in and he told me, all of a sudden, I couldn't breathe. I said, okay, what were you doing? Are you exerting yourself? He said, I wasn't exercising. I was shopping. And he was shopping at Walmart. And all of a sudden, he couldn't breathe. And so what he did was he went to the urgent care. Not right away. He went like the next day. He can kind of breathe, but not very well. And so he went to the urgent care. And at urgent care, they did all the testing. They did the labs. They did all kinds of stuff. Everything's normal. So they told him, you're fine. Go home. So he went home. And after he gone home, he still couldn't breathe. And a few more days later, it was so bad, he went to the ER. And guess what? In ER, they do more testing, they did images, they did all kinds of stuff to try to diagnose him. And guess what? Everything is normal. And after that, he had several doctors. He went to, they told him to follow up with the primary care. So he did. He followed up with the primary care, and they couldn't figure it out. Why couldn't he breathe? He couldn't breathe. Not very well. He can, but not very well. But his lung is fine. They did all kinds of testing. It was fine. And so the primary care decided, let's put him on possibly the PPI. So it's a digestive tract, right? So they put him on PPI, proton pump inhibitor. They're thinking that he is aspirating the GERD that's coming up, the acid, and going back into the lung. That's causing the issue. But there is no damage, right? And he doesn't have the typical issue of the digestive problem. And he really doesn't. I asked him all the questions. His digestion is fine. And what was interesting is they want to put him on psychotropic medication. They think it's all in his head. And so after all that, he saw 5 or 6 doctors. No one could diagnose him. And he was desperate. When he came in, he told me, and what was interesting is within 5 minutes, I already had a good idea what it was. Within 5 minutes. And something we talked about in the last webinar. And that last webinar we talked about in respiration. That was very interesting that there's one thing that I mentioned that pertains to the diaphragm. And that's C3, 4, 5 keeps the diaphragm alive. It's a phrenic nerve. He was so stressed that his phrenic nerve in the cervical area was blocked, was compressed, to the point his diaphragm cannot descend. I put my hand on his belly, have him take a deep breath. The diaphragm wasn't descending. So the phrenic nerve was blocked because of compression. And phrenic nerve, if you have to know anatomy, the phrenic nerve comes behind the SCM, sternocleidomastoid, and in front of anterior of the scaling muscle. So you have anterior medial and posterior scaling muscle. So it comes out of anterior. And also he has a numbness in the hand. Why? Brachial plexus also comes out in that area. And because those muscles are so tight, it's compressing on that nerve, causing the conduction to be compromised. And so I start releasing the neck area. And guess what? He can breathe now. So if you don't have an accurate diagnosis, I don't care what else you do. It's like shooting darts on the wall without a target. You gotta have a target. So formulate an accurate diagnosis, give us an idea on how to treat properly. And that's gonna increase your prognosis. You're gonna improve your prognosis. And number 4 is optimal health. Well, what is optimal health? To understand sickness, you have to know what is health. To understand sickness, you have to know what is health. If you don't know what health is, how can you restore it? Do you want to be like a typical conventional providers just to manage symptoms? And some people, they're happy just managing the pain. I'm more aggressive. I like to restore the function rather than just managing the pain. And yes, you can manage pain using a Tylenol. You can use the pain using opioids. You can manage pain using chiropractic adjustment. You can manage pain using acupuncture. But is that the way to manage? Do people come to you to manage pain? Initially, maybe, yes. Of course, they're in pain. They want the pain to be relieved. But reality is, most of us want to be healthy. We want to be healthy. Well, what is health? And I talked extensively on the blue zones. The 5 blue zones where we identify that they have very high population of centenarian. People live over 100 years old. And those 5 zones, yes, out of 5, 4 of them, they're in a very isolated area. Okinawa, Japan, Icaria in Greece, Sardinia in Italy. They're all islands. And then the peninsula in Costa Rica, the Nagoya. And the 5th zone, that's the one that really interests me. It's right here in the United States. It's Loma Linda. And yes, there is, I don't want to use the word religious reason, but it is because 97% of that population, 97 to 98% of that population, they're Seventh-day Adventists. So they're very specific diet. And that's why I talked about it during the time when we're talking about the digestion. And looking at, understand why they're able to live so long and be able to understand it. And also Okinawa, Japan. So I'm very familiar with those 2 regions. The other 3, also looking at commonality of all the 5 blue zones and understand why. And if you're interested, go back and watch this video, but I'll give you a short understanding of it is the calcium is one of the major components. And it's not just any calcium, it's active calcium. They all have very high level calcium intake, but they're active calcium because the gypsum, the sheetrock in the drywall is calcium. But that calcium, the gypsum, they're not active calcium. And be careful. Active calcium, what does that mean? That means it can be released with a charge. So it has a charge bind to something, be carried to the proper place. Whereas the calcium, if it's not able to be released, it's already bind to something, then we can use it. Or you can create deposit, calcification in places you don't want. And so that's very important to understand what is active calcium. And so yes, and they eat a lot of seeds. Most of the calcium coming from the seeds. So if you have a chance, go back and watch that video. And number 5, effective efficiency to optimize clinical flow. Yes, you never want to compromise effectiveness at the cost of the efficiency. What's interesting for us is when we open the clinic right here in this location, it's about 14, 15 years ago, 14? Anyway, a while back. When we opened, we came to New Mexico. We didn't know anybody. I didn't have any patient base at all. Zero. I didn't know anyone. We're new in town. But guess what? When we opened the door, that first week, we had 60 patients. That first week. And what's interesting is the following week, we reach 100 patients. So our first expansion occurred in that first weekend. We need to divide up more rooms. So initially we start with 3 rooms. I said, that's not enough. And I end up we come in 1 hour early, gave up my lunch, and then stay an hour later, just to fit patient. And at that point, it's like, oh no, we need to, it's still not enough. And so we had to divide up more rooms. So that first weekend, we put up 2 walls to divide up more rooms. And we end up with 5 rooms, and it's still not enough. A few months later, we need a bigger space. And so we end up using, we call it our great room, which we can accommodate, how many people? 18. So they're in a recliner. And so we did that just a few months later. And on average, per hour, we're seeing 15 to 20. Maximum I've seen an hour is 28 patients. How is that possible? We did it out of necessity because the patient, they keep coming in. And I don't use a lot of needles. I don't. Sometimes I use as little as 1. I average about 3 to 4 needles per patient. But they're all very accurate. So if you're studying acupuncture, what does that word mean? Is it a lot of puncturing, or is it an accurate puncture? So accuracy. I challenge myself to be effective as well as efficient. We create efficiency out of necessity, but I've always been effective. And that effective efficiency. How to treat, and how about the clinical flow? How about the staffing? And we see on a certain days, we see over 100 patients. And how do I have a lot of staff? Do I have a lot of providers? No, I'm the only provider. And we have 1 person in the front. So it's only 2 of us. How is that even possible? If you want to know, I can talk about it. I think some people have interest in that. I used 3 business coaches before we opened the door. For 2 years. We started planning 2 years prior to opening the door. And I had 3 amazing business coaches. And one of them, you might already know, he is from Austin, Jimmy Yan. Yes, and he's an amazing speaker as well, and he's a good friend. So you have a chance, watch this video. He started a successful practice, and he helped us to get a lot of things going at the same time. And from that point on, we had a good starting point, and it's a turnkey. Literally, we have patients from day one. And we'll talk about how to do that. How do you market? And do we still do marketing? No, we don't do marketing at all. We have patients keep coming in. We have new patients keep coming in, and we're able to not only new patient coming in, but we have other patients that's ongoing as well. And so at all time, we have constant patient. We only did marketing for maybe 6 months. 6 months. We don't do any marketing. Is it because of insurance? No, we don't do insurance. We're a cash practice. We do not do insurance because I have to hire another person just to do insurance. And insurance, you already know, is it a game? It could be because they pay you less, so we bill higher. It becomes a game. And I don't really want to play the game. And so for us, we were able to do it. And we did that from the get-go, is I don't want to do insurance. And so we didn't do insurance. I don't want to get trapped into the system because system will tell you what you can and cannot do. Or patient can only get 6 treatments or 9 treatments. And no, they need more than that. And if you just treat them 6 times, 9 times, and they don't get better and they stop coming. So did you accomplish what you're supposed to do? No. And so how can you have a successful practice? Really, that effective efficiency, knowing how to treat, how to create a clinical flow is extremely important. And the number 6, Bagua, and how do you apply it to health? My treatment, my diagnose, is based on the Bagua. And I use Bagua as a foundation, which is quite different than the TCM, the 5 elements, and all those things. There are some correlations, yes, but it is based on Bagua. And we can get into that. I remember Richard Tang, a lot of his focus also on Bagua. And when I had lunch with him one time, this back when I was in Oregon, this when he was still alive, we had a good conversation about it. And what he gave you is really the tip of the iceberg. But if you want to go into more detail, we can also do that as well. It's extremely effective. That's why I don't use a lot of needles. And there's really no need. It's not how many needles you put in the patient. It's how they feel when they leave the clinic. Do they feel good? You can use just 1 needle. As long as they're feeling better, you got it. When you put too many needles, you're diverting the energy. You're diverting the energy. And yes, at the end, they're very sleepy, they're very tired, very relaxed. And sometimes that is good. But reality is you end up losing the focus of where the needle should be. So it's been very specific on location of where the needle should be. Okay, so if you can pick one of the, just put 3 numbers. Or if you have a suggestion, write it in. Write it in. And I'll tell you, I don't know everything. And I really don't. I'm just like you. I'm still learning. But I'll share with you what I know that actually works and be able to repeat it over and over and over again. Okay, so the presentation outline today, we're going to talk about a few things. One thing is practical learning. Theoretical learning is for people who are teaching. In a clinical setting, you want to have a practical learning. So you want to know what works, but not only what works, you want to know why it works. When you know why it works, then when it doesn't work, then you know what to do. If you don't know why it works and it doesn't work, it worked last time, this time it doesn't work, and then you're stuck. And I'm finding a lot of people, they try to learn different things and try to apply different things because sometimes it works, sometimes it doesn't. When it works, it's great. When it doesn't work, they don't know why. So part of that learning in Chinese, call it 学习. I'll get into it in a little bit. So 学 is to learn, 习 is to practice. If you don't put it into practice and understand why and integrate the knowledge into what you're doing, then you will get stuck. And I don't like to get stuck. I don't think none of us like to get stuck. The second one, talk about the pain and the flow. In Chinese medicine, the flow is opposite of pain. And pain is such a big topic. I don't think I have enough time. I know it's 8 hours. We're going to have a fun day in that 8 hours. We don't have enough time to cover it. I can talk about it forever. Pain, to understand pain, you have to know what flow is. And so we have to contrast the two so we can take care of the pain. And is there a purpose to pain? Of course. There's a reason for the pain. People without pain, they have injury that they don't know. And you'll see that in diabetic patients. When they come in the ER, we have to amputate their legs, their toes. Why? Because they don't feel pain. The nerve died. Yes, it started as a paresthesia, but is it because of paresthesia? And is it the neuropathy? We like to call it neuropathy, right? Diabetic neuropathy or peripheral neuropathy because it furthers away from the body. And that neuropathy, yes, it starts with the paresthesia. It's that weird sensation. Now we'll talk about different types of sensation, different types of pain, and how to differentiate and understand the progression of pain. So you can understand where they are and also know how to reverse it. And so we'll talk about pain in more detail and the classical perspective versus modern understanding. So the scientific understanding of the neurotransmitter, the neural pathways, the upper motor neuron, lower motor neurons, the interpretation of the signal in the brain, and then which component and how that relates to scalp acupuncture. And so we can get into some of that. And then understand physiology, anatomy, neurology, and even pharmacodynamic and energetic of pain. How do we treat pain? How does pharmaceutical drug treat pain? And why does it work? And when it works, what's the benefit? But and remember, there's also side effect to it. Injection. In a pain clinic, when we give injection, yes, they feel better. True, they feel better. And what happens? They think the pain is gone. But guess what? All the structural issue is still there. They didn't correct it. We just blocked the nerve, right? And after you block the nerve, they go home and say, oh, I don't have pain anymore. I must be okay. So they start doing stuff. They start working out. They start playing golf. They start doing all kinds of stuff. And guess what happens to the structure? The structure is not strong enough to support what they're doing, to support the activities. And since it cannot support the activities, they cause even more damages. So when that medication wears off, the anti-inflammatory steroid typically, what happens? When they come back, the pain is worse. And I see that over and over and over again. That's why a lot of times we tell patients, you may work 3 to 4 times. And after that, it doesn't work. It doesn't work. That's why I tell people with the injection. And so you have to understand why that is, right? And you have to correct the structural issues. Or are you just doing it to manage the pain? And really, don't just manage the pain. Don't just manage the pain. Other people can do that too with the medication, with other things. Adjustment. If there's structural issue, adjustment. We call it bone correction, 正骨, right? In Chinese, we call it 正骨. For those who knows Chinese, 正骨. The bone correction, we do that too in Chinese medicine. But if you correct it to alleviate the pain temporarily, meaning from compression of the nerve and the structural issue around it, you didn't correct it, there's a problem still there? Of course, it's still there. Remember, every joint, you have muscle, tendon, ligament around it. You have soft tissue around it. And if you just do things to help move the bone structure and the muscle, tendon, ligament still tight, what's going to happen? It's going to pull right back out. So the time to do the bone correction is, of course, you have to loosen up the tendon, muscle, ligament around it. And if you don't, yes, it goes back into place, wrong place, that is. Neurology, we'll touch on that. I don't know how much you want to know in terms of neuroanatomy, but I'll point out the things that are truly important for us, for what you do, for acupuncturists. You don't have to read the CAT scan, you have to read all of that, but I do. We do that here. I do look at those because that helps me. I look for things that other doctors that they don't look for. And so those are things I do look at. And we can even have a class on that if you're interested in the future. And so I'll touch on the things that I think is pertinent to us, and also CNS, PNS, and also understand the nervous system. So the nervous system, yes, there's autonomic, right? And there are different types of nervous system, and how do they all work together? So there's voluntary, things that we have control, and involuntary, that's autonomic. And why are they different? And what's the purpose of it? And in terms of acupuncture, how does that correlate to the acupuncture? So for me, I like to bridge the two. Are they different? Of course not. It's the same body. It's the same body. And that's why I tell a lot of providers and also acupuncturists and students is don't ignore the blood pressure. We take blood pressure for every patient. And trust me, when you start improving the circulation, the blood pressure start to drop. And that's a good indication. And we see that consistently with patients, consistently. And understand and know how to explain the blood pressure. Systolic, what does that mean? Diastolic, what does that mean? Right? And so don't use medical jargon. Definitely don't use the Chinese terminology. They don't know. There's no point talking to the wall. There's a Chinese saying, is we call it 对牛弹琴, meaning you're playing violin to a cow. You don't want to do that. You don't want to play violin to a cow. They might appreciate the music. I don't know. It might calm them. But that's a saying in Chinese. Don't use the medical jargon. You want to use specific examples so patient can understand. And so when I'm teaching, I'm going to do my best on how I'm talking to the patient and use the same terminology. So you can use the same terminology with the patients and use examples and analogies so people can truly understand what you're talking about. If you're saying things I don't understand, you're confusing them, you drive them away. I spend a lot of time talking to patients. As many patients as we see, we still spend time with every single patient to understand their condition. And I explain to them what is going on and what we are going to do and how we're going to approach it. And when I don't know, I will tell them, I'm not sure yet, but we'll figure it out together. And so pay attention to your symptomology. What were you doing at the time when you're feeling the pain? And that will give me a good idea because, and I have people will use a marker and mark the points, mark where the pain is. And then they remember I was doing this, I was doing that. I'll give you a good example. I had a patient and I was treating her for the back and the hip. She was getting better. But what's interesting is every morning when she gets up, it's worse. Oh, so guess what? I have to ask her, were you better the night before? And she was. So what are you doing when you're sleeping? Valid question, right? And she's married. So I said, what is your husband doing to you when you're sleeping? I asked her, and she didn't know she's sleeping. I said, okay, let's have your husband take a picture of you while you're sleeping. You cannot be awake, and make sure you're dressed appropriately and take it from different angles. And so the husband did, and she brought a picture. That's why. That's why the back is hurting. And so what she's a side sleeper. And what she likes to do is crossing her leg all the way over. So she's shifting everything. So every morning she has the pain. So I told her, get a pillow, big fluffy pillow, put it between the legs, and that solves the problem. And so you have to get to the point of understand the pathogenesis. Why did it happen? Otherwise, you're just managing pain over and over and over and over again. It may be good for business, but for me, I don't feel good doing that. I want patient to feel great. I want patient to feel amazing. And so that's very important that we're not just managing symptoms. We're actually restoring the function and the constitution. It's give an idea, and I use it to explain to the patient too, what's the difference between constitution and pathology. So pathology or pathogen is anything that can cause disease, disorder, disharmony, things we don't like, they're pathogens. And yes, in Chinese medicine, we call it 邪气, and please don't use evil qi with patients. Use pathogen or pathogenic causes or factors, and that's okay. So instead of using the word evil qi, you're going to steer them in the wrong direction. So use the word pathogen. And opposite of that, again, remember, you have to always think in polarity. Okay, so if there's yin, there's yang. So there's always polarity. And absolute yin and absolute yang, we don't exist. We exist in between. To restore the harmony in the body is bring us back to the middle. So pathogen, what's the opposite pathogen is constitution. And constitution is more than your immune system. It's every single function in your body, including immune, cardiovascular, digestive, respiratory, every single system in your body, and how well they work together. And that's your constitution. We call it 正气, 邪气, 正气. Just reference to the classical Chinese medicine, the terminology that we use. Don't use those terms with patients. They don't understand. But when you use constitution and pathogen, they will understand. And imagine there are two armies. And on this side, you have 400 soldiers. But this side, you only have 200 soldiers. And they're going to battle. Who's going to win? Provided, yes, they're all trained the same. One time I have a general, and he was challenging me. Well, it depends on how they're trained. And what kind of weapons they have. Okay. They all have the same equipment. They're trained the same way. So the 400 and the 200. Who's going to win? Of course, the 400. But at the same time, if this is 400 and this is still 400, same number, but then you have 2,000 over here. And they go into battle. Who's going to win? No doubt, it's a constitution. That's why when you are in a hospital environment and you have a group of healthcare providers catering to the same patient, and some get sick and some don't get sick, you have the same exposure here. The pathogen is the same. But why do some people, they're okay, and some people are not? That's because of constitution. And so if you look at conventional medicine, which side are they focusing on? Are they focusing on pathogen or are they focusing on constitution? You already know they're focusing on the pathogen, right? The microbiology, that's a pathogen. We can have the same exposure to the pathogen, and guess what? We all have pathogen around us and in us. And some are good for us, right? And at that point, it wouldn't be pathogen. The microbiome, the good bacteria in the gut. And we do want that. And yes, for most of us, we don't have, in the United States, we don't have enough fermented food. So a good way is do the vinegar, and not just any vinegar, the Japanese black rice vinegar or the red rice vinegar. I take a shot of that every morning. So did you do your vinegars this morning? And not only a shot in the morning, what I do is I take a pinch of salt, Hawaiian salt, not Himalayan, Hawaiian. Himalayan is a mountain salt. Mountain salt is missing a lot of ocean component, like iodine and other mineral content that we want. Whereas in Hawaii, you have both. And for those people, I know there's some from Hawaii, aloha. So that Hawaiian salt contains both the ocean component plus the volcanic, the mountain. And so Hawaii is actually the tallest mountain, I think. from the ocean floor and up. Is taller than the Himalayas. Anyway, irrelevant. I think stay focused. So if you look at the salt, just take a pinch of that salt and dissolve it in the vinegar, and that vinegar will activate the mineral content into the electrolyte. Just do that every morning, because really, in reality, in the United States, we don't have enough fermented food. We have tons of processed food, but no fermented food. And even the pickle that we make, you buy in the store, that's on the shelf. If you look at the label, there are chemicals in it. They add chemical back into it. And at that point, what do you do to all good bacteria? You just kill it. And so you want to make sure that pathogen and constitution. Our goal is restoring constitution. Is it possible? Absolutely possible. I've seen it over and over and over and over again. And you want to make sure that you're able to restore that highest level of constitution. And that's why I call it the optimal health. Okay, so that's important. And that's what I use to explain to patient. Do they understand it? Of course. Do I use the same thing I explain to other doctors? Yes. We see a lot of doctors as well, physicians of all kinds. And so understand how to restore the function. And to restore that function, you have to know what health is. Okay, and that is the flow. No flow, pain. Pain is a beginning phase of the disease that we can sense. Meaning based on our sensory component, we're able to pick it up. But it happens even before that. Okay. Let's see, how much time do we have? The first hour, I like to do some of the introduction, and we're still in that introduction right now. There's so much to teach. 8 hours seems like a long time, but I still run out of time. Every single time I run out of the time to talk about stuff. There's just so much that I want to share with all of you, because we can really, really improve what we do, because what we do is so amazing. And believe it or not, you guys are in an amazing field. You're in an amazing profession. But to have that amazing profession, it comes with responsibility. Sounds like a movie. It is a movie. So that the power and responsibility. So that responsibility is you have to know how to utilize what you know, and learn how to touch someone's heart. Don't just treat the body, touch their hearts. Touch their hearts. That's why we're here. So that flow, yes, there's a physical component of the flow, the body, but also there's a spiritual, and the emotion and the spiritual component. A lot of emotion, you already know. What does emotion do? Does it cause stagnation? It does. Well, how does it cause stagnation? Right? The emotion, what happens with emotion? Everything tightens up. It puts the body in a parasympathetic state. And when in that parasympathetic state, sympathetic state, we like to blame cortisol. But is it cortisol? It's getting blamed for a lot of stuff. We call it the stress hormone. And no, I like to call it the waking hormone, because it counters melatonin. It helps us stay awake. So melatonin, when it starts to subside in the morning, when we wake up seeing the blue light, cortisol start to go up and start inhibit the melatonin. It's a waking hormone. We do need the cortisol to stay awake. And that cortisol, there's a maximum, there's a minimum. And you want to know what that normal is and stay in the normal. When it's too high, of course, it puts you in a sympathetic state. And that sympathetic state is the 4 Fs, right? Fight, flight, freeze, or you are fudged. Ignore the last one. So it's a sympathetic state as opposed to parasympathetic state. And so that sympathetic and parasympathetic. In a sympathetic state, we become reactive. In a parasympathetic state, we're responsive, meaning we can respond without reacting, meaning the signal is getting to the brain. A good example is the knee jerk. It's also a knee jerk effect, meaning you tap the knee, and the knee jerk, meaning the signal goes from here to the spinal cord and back, sensory in, motor out. And so sensory neuron goes into the spinal cord and comes back out. It does not send to the brain. Whereas the responsive, the signal actually gets to the brain. And so you can determine that the brain can interpret the signal. And so reactive versus responsive. And that's very important. Once you get to the reactive state, it's not a cortisol, it's adrenaline. So at this point, it's actually adrenaline that's causing this, not a cortisol. But yes, cortisol gets blamed for it. So what can we do to make sure that we have the right kind of hormone to control the cortisol level, to bring it down to the normal range, right? And what are the hormones? We will talk about that later in more detail. And yes, endorphin is one of them, serotonin, oxytocin. There are a lot of hormones, dopamine. And so like dopamine, serotonin, we use that extensively in medication to help with the psychotropic. So that spiritual flow is part of the equation. We call it liver qi stagnation, right? Interest, the word that we use when someone is angry or mad, we call it sheng qi. And yes, this is a traditional Chinese. Simplify is this without the rice in the middle. And sheng is to grow or to become. And qi is qi. How can you become the qi? When there's a liver qi stagnation, it's because you have too much of it. That's causing a stagnation. Well, that doesn't really explain it, does it? It's a stagnation that's creating the heat. That's creating the heat. And in that heat is a yang qi. So yin and yang qi. And that's why people have a high level of anger, the face turns red, that bright red, because they have so much yang qi that's stagnant to the upper body. And so you see that the artery will be bulging. And there's an implication of that to the cardiovascular flow as well. And we can get into that another time. If you're interested in more specific to a cardiovascular and how we can help people restore their cardiovascular health. And for us, we're very fortunate to be able to see so many patients. So the experience that we accumulate over the years is irreplaceable. Because what I learned in the classroom versus what I'm able to see and see it work consistently over and over again is completely different. And if an average acupuncturist sees, let's say, 25, 30 patients a week, and versus someone who's seen 100 patients a day, it takes another person 10 years to accumulate the same experience. So that's irreplaceable. So for me, I'm sharing with you from my clinical experience and try to understand based on the little thing I know from the Western medicine and the Chinese medicine. And so I'm fortunate when I was studying Chinese medicine, I was studying in the original language. I can read the classical text. And today will be referenced a lot to the classical text. Huangdi Neijin in particular. There's so much validity in the observation based on Huangdi Neijin. And it's using our understanding currently in science to decide, okay, why is that? Why is that? And to be able to bridge the Western and the Chinese. And so that's very interesting. So that qi stagnation, sheng qi, why is the growth of qi? Is because it's stagnant first or because too much qi first? Of course, it's stagnant first. And we'll get into more detail of it. And the energetic, right? What is qi? We use that word in Chinese as air. Are you full of air? So it's the same word that we use, 空气. 空气 is the air. And 空 means empty. Empty qi, meaning it's non-substantial, it's in the air. And so it's understanding the specific on why. I'm always curious. I like to ask a lot of questions. And when no one can answer, I have to try to figure it out. And so all this is over the years of figuring out things that I'm sharing with you. Okay, so that's let me see what's next. Okay, learning. 学习, I kind of touch on all of that. To learn, you have to put it into practice. You want to learn practical learning, not just theoretical learning. Theoretical is good because we have theorized and hypothesized and try to see if it works. And that's good. That's a good starting point. But the end point is always practical learning. You have to take what you know and understand and put it into practice and incorporate it. And so that's very important. And scientific method versus observational. Use observational and then try to understand it using the scientific, using the science to understand it. So the observation doesn't change. Meaning sun's gonna come out from the west? No, east, right? And so you have to understand that east and west. And even like a compass, for example, does it face the south or north? It depends. Is it eastern compass or western compass? Western compass, it's point north. The traditional Chinese compass, point south. The polarity, we reverse that polarity. We call it 指南针, point south. And so is that important? It is. The polarity is important in sleep. So how do you position yourself so you're not counter current when you're sleeping? Is there current flow on Earth? You betcha. Otherwise, there's no rotation. And what allows it to flow? Is it electrical or is it magnetic? It's magnetic. It's a magnetic field, North Pole and South Pole. And that allows the Earth to rotate. So there's a flow of energy. And if you're in a counter flow, does that affect your energy? You can count on it. And that's why in the classical Chinese medicine, we talk about even the positioning of sleep. It's in Wang Di Nei Jing. It's in the Yellow Emperor's classic. And so it's to understand and apply, okay, back then they may not know the magnetic field, but they already, based on the observation, they're able to give us the recommendation. And that just blows my mind from the Western perspective. How did they know? That's thousands of years ago. How did they know that? I get excited. Yes, I do. And then if you look at the symptom versus constitution, right? Do you want to just manage symptoms? If you live in a house where there's a crack on the wall due to the foundation, do you want to just patch the crack? If you do, what's going to happen? There's no crack some more, and some more, and more crack, and before you know it, the entire house will fall. Let's fix the foundation. Let's figure out, it does take more time to fix the foundation. It does take more time to restore the function of the body and the constitution of the body. So you can bring the patient to the level of their optimal health. And trust me, we have so many patients that we're able to bring them to that state of optimal health. There's so many cases I can share. But more important is the understanding behind it. And that's why that diagnosing is so important. What kind of question do you ask? If you don't ask the right question, you can ask 10,000 questions and still miss the one question that you're supposed to ask. All it takes is the right question that's going to give you, that's it. That's it. Makes sense. And people come and say, oh, I have a certain condition. I say, no. Do you really want it? Do you want a condition? And they think about it. No, I don't. Don't think of it as a condition. Think of it as a transition. You don't have a condition. You have a transition. Whatever it is, we're not even going to give it an identity. And that's why I love about Chinese medicine. We use pattern differentiation. You don't lock a person into an identity. And people say, oh, I have this. Now, do you really want it? I don't want it. Do you want it? Don't claim it. So think of a transition. How are we going to transition out of it? And so that's very important. So in the learning, you have to know how to think and how to approach. Okay, so yes, I think it'd be a good time to, we'll save that for the next hour. Any questions?
So, you were talking about structural problems
Mm-hmm.
versus when there's a stagnation of flow.
Mm-hmm.
How do you tell when treating a patient if there's a structural problem versus pain due to the tissue damage? And how do you differentiate this as the patient's reporting their progress
Uh-huh.
and the types of pain they might have, sharp, dull?
Beautiful, beautiful. Okay, we'll get into more detail, but I'll give you a preview answer to that. That's a really, really good question. So when you treat a patient and they leave and the pain is better, and I tell a patient when the first time when they come in, pay attention to how you feel. When the pain comes back, so the duration of the onset, of course, and what you're doing around the time of onset, we want to look for triggers and the duration. So you have to know the duration. How long does it last? Does it come and go? And the pain, the quality, of course, what kind of pain, and we'll get into the detail of pain. And yes, it's already in the Huangdi Neijin, and it talks about quality of pain. It differentiates to the 14 different categories of pain. So we'll talk about what that is. And then the other besides that is the severity. And so are you going to heal right away? Well, if it's acute without damage, yes, you can have one treatment and the person is fine. But once there's structural damage, the pain will come back. Do tell patient that. Be honest with them. Otherwise, they'll come back and say, it doesn't work. Say, okay. When we have needle in, how did you feel? Oh, I feel good. No pain. And when you left, how did you feel? I feel good. No pain. But then when I was working out, the pain came back. Okay. So I tell people, don't work too much. Take it easy in the beginning, and that help us identify the location, especially based on what you're doing at the time. And is the pain coming back suddenly or gradually? That's a key word. Do they come back suddenly or gradually? If they come back suddenly, there's a major structural issue. When it's gradual, it's better. It's better. So two things I look for in the very beginning of the treatment is the pain relieved? Because you're able to relieve the pain and they feel better, then that tells you you're on the right track. Pain can come back. It can even come back to the same degree. So if it comes back to the same degree, that's another indication that maybe that structural issue is more severe. So there's a structural issue, there's a structural component. Does that answer the question? Okay.
What role do emotions play in patients with chronic neurologic pain? Are there certain emotional patterns that you typically see?
They're not happy. They are not happy. And really, they're in pain. They're in pain. We have a patient that comes in grumpy. We start treating them, and they're the nicest person because they're in pain. We'll get into emotion more, but I want to, if we have time, we'll get into more. That's because emotion is huge, huge. I also do counseling with patients, and that's for the emotional components.
Is that vital to part of the healing for people with neurologic pain?
Absolutely. One affects the other. If you're not happy, it causes stagnation. Stagnation causes pain. So it can flow, one can affect that. Or if you start with trauma and pain and not happy. So yes, it can go either direction.
For clinicians who are working towards more trying to see more patients, how much time do you typically spend with each patient?
So for me, you're talking about treatment versus the time I'm sitting down one-on-one. And when I sit down, the initial visit is 30 minutes. I spend the 30 minutes to understand what is going on. And then the treatment depends on how many needles I put in. Sometime the time I spend with that patient is less than a minute. I'm just putting needles in. I already know what's going on. And is it going to change between now and, let's say, 3 days later or 2 days later? Not that much. I only ask a few questions in that case. How is everything? How is everything? And where's the pain? How is the pain? Any discomfort, right? And you want to ask and let them tell you. Listen, but don't listen with your ears. You always listen with your heart.
When a patient is coming in with chronic pain, especially neurologic pain, do you talk to them about the inflammatory impacts of such foods such as sugar, and also what nutrients do you suggest for healing the nerves and specifically?
Absolutely, I do. If you haven't had a chance to look at the component that we talked about based on nutrition, I think we had 2 webinars on that. Go back and review that if you have a chance to take a look at it. I spend time with patients to talk specifically on nutrition. We set up a separate time to talk about nutrition. And I go into detail on what kind of food to eat and an easy way so they can remember. Remember, you have to make it easy. And so for those of you who attended, you already know the triple F, right? What kind of food? Fresh, frozen, and fermented. Live food, F, and that F is the triple F. French fries, oh no, I mean fresh, frozen, and fermented. If you have a chance, go back and look at it. And I do spend time. Is supplement important? I'm a naturalist. I prefer to get everything from the food. But because of the soil depletion, and we're not really getting enough from the food nowadays, and especially if you don't have the gut bacteria to process the food, you're not getting nutrients. And so if you have a chance, go back and look at that. So that 3 components, giving the body what it needs: water, oxygen. What kind of water? What kind of water is good? Water, oxygen, and oxygen. How can you tell when there's a problem with oxygen? And what are the signs, right? And go back, we did that on last time, on the breathing, on the oxygen. We're in a high altitude, so we see a lot of respiratory issues. And what's interesting is we live in a desert, right? So people in Texas is that, oh, move to New Mexico because it's dry. When people have respiratory issues, so we have a lot of patients move from Texas or places that are more humid to here, and when they come here, they might feel better temporarily, but they have other issues because we're at higher altitude. And so it's really interesting. If a chance, go back and look at that. Give a body what it needs, deliver it, give time to repair.
When people are in constant neurologic pain, they're more likely to be in the sympathetic state. How do you support them to access a parasympathetic state, especially between treatments, to continue the healing when they leave?
Acupuncture will bring down the cortisol. Acupuncture, and there are enough studies that substantiate that acupuncture will increase endorphin, will increase serotonin, oxytocin, and dopamine. And there are other hormones that it secretes. And so that by itself will bring them down more into the parasympathetic state. But in the meantime, when the inflammation is less, and you're using acupuncture to bring down the inflammation, you also have to consider what's wrong with the structural issues. If you don't do things to take care of structural issue, and when do you take care of structural issues? And we'll get into that later. And later, if you want to know in even more detail, then the prognosis, the diagnosis and prognosis, and we'll get into even more detail on that.
How do you break down your initial exam and intake into the 30 minutes? Ask
the right question.
And what services do you offer?
What services? It's not what we offer. It's understand what patient needs. Understand what patient needs. And yes, we do Tuina, we do cupping, we do physical therapy. I do needle massage. If you don't know what that is, we can talk about it. Needle massage. How can you massage with needle? Well, the finger can't get that far, but the needle can. So how can we do the needle massage? We do herbs, we do nutritional, we do emotional counseling, and I have patients throughout the world. We have patients that I talk to regularly and send them herbs. Herbs is very important. They may not live here, and we have patients who are using other acupuncturists out of state or out of country. And out of country, we don't send them herbs. It's harder across the border. But within the US, we send them herbs. So there are a lot of things that we do. We're in a state where I can order lab. I don't order labs for one reason. If I order the lab and my name is on it because I order it, and I miss something, guess who is liable? You are. Well, I am in this case. But since I don't order, I'm not. So even though we can, I don't. Because the coverage insurance, and check with your insurance, your malpractice insurance, make sure that part is covered. From my understanding, it's not covered. So don't do it even if you can do it, because you're liable. I'll give you a good example. Let's say a chiropractor, and they do they do adjustment, manipulations, DO, osteopath. So adjustment, the chiropractors, they take a film of the chest X-ray, and then it's misaligned. So because that's what they're looking for. And so they do things and adjust them. And a few months later, the patient had cancer in the lung. And then it showed up on the X-ray that you order. But because you didn't pick it up, you're liable. Be careful. Be careful.
In your follow-up visits with patients, how long are they on the table or in the office?
So going back to the classics, right? 21 minutes. Some people say 21 to 22 minutes, in that range. But that's starting from the time that the person can relax. And can everyone relax right away when they come to you? Sometimes they're rushing in the traffic, right? So you want to give them a little more time so they can relax. And so and I know this question doesn't really pertain to what we're talking about here. It's talking about, if you want to know about the effective efficiency, the flow of a clinic, we can talk more about it. I know there are a few questions pertaining to that. And I'll share with you at that point. And so, yes, we schedule an hour. We schedule an hour. And the way we do the scheduling, it's over time, we iron out the detail so we can be very efficient, effective efficiency. What's amazing for me is that effective efficiency. I'm from Taiwan. And every time I go back to Taiwan, I look at how people operate, and even the street vendors, how they're serving food. There's such a long line, and they're able to be so efficient and effective in serving the patients, the customers. And I'll go to a hospital, I'll sit there and watch how they operate everything. It's so efficient, effective efficiency. I learn a lot. Every time I go back, I just observe. And that effective efficiency, and that's why if you look at the microchips, TSMC, why are they able to make the chips where no one else can at such a high level with the effectiveness and the efficiency? Okay, I think we have how many minutes break? 15 minutes break, and we'll come back and continue.